It's been 5 years since New Orleans East Hospital first opened its doors. That project was a long time coming after Hurricane Katrina devastated a majority of that area 14 years ago today. Well, since opening, the grand opening that is, New Orleans East Hospital has provided top-notch health care to services all across the metro area. Joining us now are board-certified internal medicine specialist and primary care physician Dr. Jan Cooper and board-certified family medicine physician Dr. Bertrand Tillery to talk more about the importance of having a primary care physician. Thanks for joining us on Great Day.
Thank you.
Thank you for having us.
So starting out, what is a primary care physician?
Well, a primary care physician's major role is to provide definitive health care in an undifferentiated patient population. Once a patient comes and sees that physician, he becomes responsible for their comprehensive health care as a whole.
Okay, so why is it important to have a primary care physician even if someone has good health?
Oh, there are several reasons. The first one being that many illnesses, medical illnesses, have no symptoms, like high blood pressure, diabetes, high cholesterol. And remember, these are the risk factors for heart disease, and heart disease is the major killer in our country still. So you got to go see your primary care physician to diagnose these problems and then to treat them if they're there. Also, preventive measures like cancer screenings, for example, immunizations. Those are important. You may not be feeling sick, but you get those done, and maybe you may pick up cancer when it's in a precancerous state even, and you can cure it then. And then finally, very important, even if you are healthy, it never hurts to have somebody in your corner say, you're doing great, and to encourage you to continue to live like that.
So what can you expect when establishing care with a new primary care physician?
When an initial patient comes in and sees me, our initial conversations are going to be with respect to a comprehensive medical history to find out how they're living, what medical problems they may have, their family medical history. Also, we're going to review body systems to inquire if they're having any specific symptoms. Are you having low back pain? Are you having any numbness or tingling in your feet? And then from there, a comprehensive exam will ensue. And then from the clues that I've received from the initial medical questions, then I can determine which direction their evaluation should go, what screenings are necessary, and look at their age and risk factors as well.
And everybody's different, right? So it's really important to, find a primary care physician that works for you.
Most definitely.
So how do you choose a primary care physician that works for you?
Yeah, so to me, word of mouth is the most important thing.
Okay.
So talk to your family members, talk to your friends, talk to your coworkers. You'll find out, who are the good physicians. And then, of course, it depends on who your insurance covers. So you've got to kind of hook the two up. And then once you find the physician, you make your appointment, you go see the physician, and you got to feel comfortable. You got to feel like the physician is listening to you, is taking you seriously, and you have to feel like you're getting taken care of and getting good care. Yeah.
I'd like to point out also, in some patients that are uninsured, there are some places, there's certain clinics that can do sliding scale and provide other services, even at a discount with regard to laboratory services and even imaging costs.
Okay. And then how soon in someone's adult life would you recommend they really, look into getting a primary care physician?
Honestly, I would think it starts in pediatrics and continues throughout. A lot of insurance plans offer an included wellness visit in which you'll pay no copay, at which time you can go in and speak with the physician regarding what's going on. Basically, you can say, hey, I'm doing fine, but let me get checked out and see what's going on with me.
Sure. Okay. And so we mentioned acute and chronic illnesses earlier. So what are the primary steps to delivering preventative services to patients?
In my mind, it's, the patient has to see the doctor regularly. You see your primary care physician regularly, at least once a year, you're going to get those things because that's part of the, the annual visit.
And once a year is for someone that's in good health, right?
That's for someone, yeah. If you have chronic medical problems, you're probably going to be seen more often, but at least once a year for everybody.
Sure. And some of these chronic illnesses, can you mention those again and kind of tell us maybe how often someone should or shouldn't be seeing their primary care physician?
Well, it depends. So diabetes, which is of course a major, an epidemic in our country, as is pre-diabetes, which is the stage in between normal and diabetes, which is crucially important to diagnose because treating that can prevent diabetes. But if you have diabetes and it's poorly controlled, you have to come in at least every 3 months, possibly more often. But if you have hypertension that's well controlled, come in once a year. It just depends, same with cholesterol. We put you on a new medicine, you'll have to come in 3 months. But if you're doing great, see you next year.
All right, sounds good. Thank you. So to learn more about primary care physicians and all the services at New Orleans East Hospital, go to the website noehospital.org. You can also visit the hospital at 5620 Reed Boulevard or give them a call, 504-592-6600. And there's much more to come on Great Day After the Break, so stick with us.